Hi, everybody. We're going to continue with our discussion on inflammation. We're almost there. I know this is a long topic, but hang in there. So, we're going to look at chronic inflammation because we finished the long topic of acute inflammation. Well, sort of, because we still need to look at the systemic effects of acute inflammation after we finish chronic inflammation. So, as we mentioned before, when acute inflammation doesn't resolve itself, then the next thing that might develop is chronic inflammation after a few weeks of a subacute phase. And chronic inflammation can last for months, years, possibly for the rest of a person's life. So when we hear chronic inflammation, we tend to think of such things as lupus and rheumatoid arthritis, right? So those are examples of autoimmune diseases. And so indeed, autoimmune disorders are a very good example of where chronic inflammation is rampant. There are also some hypersensitivities that are forms of chronic inflammation, and we will discuss in great detail what hypersensitivities are. But in addition to that, a person might develop chronic inflammation in response to an infection by a pathogen. And then the best example of this is the pathogen that causes tuberculosis, Mycobacterium tuberculosis. Remember, it has the ability of forming these tubercules. We've mentioned those before, and we're going to come back to those and expand on them a little bit. Um, Other things that we might, for instance, inhale um, can create chronic inflammation. So foreign particles like talc or silica or asbestos, even surgical sutures. Of course, we don't inhale those, but if left in a person who's let's say allergic to them, it can create a form of chronic inflammation. So remember when we studied acute inflammation, we learned in exactly what order the different steps were, right? Anywhere from leukocytosis, with especially the neutrophils arriving first. So they migrated and they did their rolling, and then they crossed the blood vessel, right, to enter the tissue, and then they released chemicals to attract other white blood cells, etc., etc. Well, of course, that I just described the whole cellular phase. Prior to that was the vascular phase. So we're going to do something similar in the for chronic inflammation. So remember that in acute inflammation, the first cells to arrive, the first white blood cells to arrive, were the neutrophils. That is not the case in chronic inflammation. In chronic inflammation, we mostly see macrophages. Do we see macrophages in acute inflammation? Yes, we do. But the most common cell and the one that is first to arrive is your neutrophils, with one exception in some form of a bone inflammation. And then after the macrophages, all kinds of other white blood cells arrive, just like in an acute inflammation. Now, in an acute inflammation, after a while, the macrophages begin to disappear, but not so in a chronic inflammation. They persist and they start to accumulate. And this might ultimately lead to these macrophages literally isolating the pathogen, which we see happening with the tuberculosis bacterium, or the particle, perhaps the silicon particle. And we'll look at some pictures here of tuberculosis to better understand that. Not only do these macrophages continue to accumulate, but after they have been phagocytic, like they normally are, they do in acute inflammation, they go on to another level, which we call activation. So many of our immune cells, but particularly the macrophages, I haven't gone into great detail on this, but they go through these different levels of activity. And so after they've gone through phagocytosis as their main function, they might become even more activated. Sometimes it's referred to as hyperactivated, and they begin to seriously secrete inflammatory mediators. And of course, that leads to severe inflammation. They also will trigger the arrival of fibroblasts. You know what fibroblasts do? They secrete fibers such as collagen, and that leads to scarring. Well, if this happens in our internal organs, we're going to see all kinds of problems with the functioning of that organ. What we don't see in chronic inflammation is the formation of an exudate. So no exudation, so no formation of pus or anything like that, or even a very serous type of exudate. So that is another big difference between acute and chronic inflammation. So the first difference was the fact that in acute inflammation, first and foremost and most, we see neutrophils. Not so in chronic inflammation, where it's macrophages, and more macrophages. In acute inflammation, we form exudate, which we do not form here. A form of chronic inflammation called granulomatous um, chronic inflammation is very characteristic for tuberculosis, where, well, the name tuberculosis comes from the fact that literally tubercules are formed in our lungs. And it all has to do with macrophages primarily, and some other white blood cells, but macrophages primarily isolate and then um, en- enclose the Mycobacterium tuberculosis. Let's take a look. So here we see a typical, what we call a granuloma in a lymph node. We'll learn on the next slide exactly what makes up a granuloma, but this is how primarily macrophages isolate the foreign matter, whether it's a pathogen or a foreign particle. And in the case of the lungs, what's going to happen if it's tuberculosis is that these granulomas can protrude, and then we refer to them as tubercles. So here's a tubercle and there's a tubercle. From there, the term tuberculosis. So what does this granuloma really look like? Well, the very center, that's where our pathogen or our foreign particle, maybe silicon or asbestos, is trapped, and it's surrounded by macrophages, and they've changed, they've become very specialized. They almost look like epithelial cells, and so they get this new name, and that is epithelioid cells. They can even fuse and become these huge cells called multinucleated giant cells. That's in the very center of that granuloma image that I just showed you. If we look towards the periphery, that's where we're going to see a whole bunch of other white blood cells, and even still some of those fused macrophages. What can happen also is that there are going to be necrotic cells forming inside of these granulomas, and that then leads to our form called caseous necrosis. Remember the cheese-like looking type of necrosis. So we're finally done discussing acute inflammation and chronic inflammation. And so I'm leaving you with a table on this page and the next page that compares and contrasts acute inflammation and chronic inflammation. And so this then tells us that we're finally done with the two major forms of inflammation.